Good afternoon, and thank you for allowing me to speak today. I'm John Redman. I'm the CEO of Community Alliances for Drug Free Youth. We're a non-for-profit organization based out of California that was created during the parent movement of the late 70s, early 80s, and focusing on youth drug prevention. We focus and support sound drug policy, not only at the local, but state, national, and international levels. CADFY holds consultative status in the United Nations, and we work on global drug policy at that level. We're not here to really discuss or argue the merits of the medicinal use of CBD. What we are concerned about, however, is the amount of THC that will be allowed as an adulterant within CBD products that negatively impact our youth. If you take a look at this picture, I took that only weeks ago in my hometown. That is water that's being sold to businesses and homes that say it has CBD products in it, and I have no idea what's in it. We have no idea what the THC levels are, and it is vastly unregulated compared to our municipal water that I don't drink. Our request for action is that the FDA should proceed with extreme caution and treat any levels of THC as unsafe, especially for vulnerable populations. And to protect the public health and safety, we urge the FDA to prohibit THC in CBD containing consumer goods, that is any amount. I won't go over all of the concerns of the harmful effects of CBD or THC. I mean, you've heard that ad nauseum today, but suffice it to say that we know that THC significantly impacts youth much more than adults. And the question is, how much THC is too much? We have no idea of the THC amount, percentage by weight consumed, that causes dependency or addiction. We have no idea of the THC amount that causes first-time episodic psychosis or other chronic reduced health effects. We also know that THC permanently changes brain structure and the developing mind. One thing to look at is how much THC is too much. If we take a look at some of the states, or we just take a look at Oregon. Oregon has stated that 5 milligrams of THC will produce psychoactivity. So that means no more than 5 milligrams of THC in a serving. But when we take a look at the hemp bill, we have 0.3% of dry weight. Well, what does that mean? If you take a look at a joint that contains 63 milligrams, 17 milligrams of THC is ingested into the body. An edible that contains 50 milligrams packaging, a serving is 5 milligrams of THC. If you take a look at a 30-count bottle that can have 360 milligrams and a single 4-gram CBD gummy bears, those can have, a single gummy bear can have 12 milligrams of THC for a CBD product. For 30 milliliter bottles that contain CBD oil, that contain 82% milligrams and a single serving of 2.73%. All you have to do is take 2 servings and you're over Oregon's limit. Some available products, I looked on the website. Here's one product on the left that has 2.8 milligrams. If you multiply that times the 0.3%, you get at the bottom what they say is 84 milligrams of THC in that CBD product. Another one, at 2.89% of THC, you have 86 milligrams. When we take a look, it's been said that all we have to do is just put an age limit on it. It didn't work for alcohol, folks. It didn't work for tobacco. We know that putting age restrictions on products don't work. And we also know that the most abused drugs in our youth, number 1, alcohol, number 2, tobacco. It's not going to be any different for marijuana products. The 3 things that come together to increase youth use is attitude, advertising, and availability. I've heard all of those talked about today. All 3 of those will create a perfect storm. All one has to do is look at the permissive drug policies of certain states that have legalized marijuana and look at the higher youth use rates in those states than those that don't have it. And yes, we have the data on that. Our request for action is the FDA should proceed with extreme caution and treat any levels of THC as unsafe, especially for vulnerable populations. To protect the public health and safety, we urge the FDA to prohibit THC and CBD-containing consumer goods at any level. Please treat this as a drug and not as a commodity. Please look at this as a public health issue and not as a profit issue. We urge the FDA to look at this and strictly regulate it. Our youth deserve it. Our nation demands it. Thank you.